A 60-year-old female presents to the orthopedic clinic with the complaints of hip pain. Your task is to make a focused history taking and examine the hip joint. Dr. Anil Srinivasan, and today we are going to see about the hip joint, history taking, and examination. The hip joint pain could be due to various reasons, and it can be during the childhood as well as in the old age group. In children, during the initial ages from 0 to 4 years, so the more common one is the developmental dysplasia of the hip, Perthes disease, and transient synovitis follows next. And during the prepubertal ages, especially in obese individuals, slipped capital femoral epiphyseal is more common. And in the old age, there could be various reasons, ranging from claudication due to neurologic or vascular causes, sciatica, osteoarthritis, bursitis, tendonitis, and any neck, the acetabular tear, the labral tear, fracture neck of femur, and secondaries in the hip joint. Some of the important things we shouldn't miss while taking up the history of back pain, because most of the hip joint pain is usually a referred pain from the spinal cord, usually the lumbosacral as well as the sacroiliac joints, stiffness, early morning stiffness, excessive or restricted movements, any motor or sensory deficits, and rough and smooth movements. Don't miss to take up the history of fever, any inflammation in the skin, swelling, history of trauma and any autoimmune diseases, any history of cancer, or any motor or sensory problems. So, as usual, we go with Socrates, site onset, character, radiation, associated symptoms, agg- uh, site onset, character, radiation, aggravating associated symptoms, during which time of the day, exacerbating and relieving factors, and the severity of the scale of pain. Other important things which we need to ask regarding the pain is, does the pain keeps you awake? Any stiffness in the joint? If there is a joint, if there is a stiffness, during which time, when is it more? Any early morning pain, restriction of movements, any history of pain, radiation of the pain to the knee joint, or back pain radiating to the hip joint, any pain while climbing up the stairs, how far he can walk, to rule out any cardiovascular diseases, any night pain, any trouble with shoes and socks. Was there any history of hip problem as a child, and a history of trauma? The associated symptoms which we would be asking for is swelling, fever, any history of trauma, as I said before, and stiffness, weakness, numbness, neck pain, both shoulder, and if there is any pain in both the shoulder joints. So this might indicate polymyalgia rheumatica. The past history, we would be concentrating more on the cardiovascular diseases as well as in the peripheral vascular diseases, any autoimmune, diabetic, or thyroid disorders, any sacroiliac joint or a lumbosacral joint pain. In females, don't miss to take out the menstrual history and also the number of children they have, and what was the type and mode of delivery. So, because that could be the reason of the hip pain. Any family history of similar pain in the hip joints. Socially, we need to ask about regarding the occupation, smoking, alcohol, drug, medication, and allergic history. And lastly, how is the mood, if there is any depression or any other coexisting psychiatric illness. So with this, we then proceed on to the examination. So in the examination, we follow the usual protocol: introduce, confirm the patient's identity, wash her hands, explain the procedure that I'm going to do certain examination of the hip joint, okay, and make sure that there is no pain, and confirm that if the patient has understood about the examination, and you ask him whether you are happy to proceed regarding this, and expose the patient joint, expose the patient. So for this, we need to expose from the abdomen, usually from the xiphisternum until the toes, so they can wear the innerwear. And first, we will be asking the patient to stand, and we will be examining, doing going through the inspection findings. Then later on, we will do the palpation, then movement. Then we will be measuring the joints, do some certain special tests, and other examinations. So, first thing we would be looking for is any abnormal posture. Then, is for example, certain hip joint pains, such as if there is a fracture femur or if there is a posterior dislocation of the hip. There will be certain abnormalities, which is more common. So we need to look at if the hip joint is kept at any abnormal posture, and we will ask the person to stand up if he doesn't have any pain, and we would ask him to take a walk and observe the gait, if there is any compensating or if there is any antalgic gait. Then we will ask the person to lie supine, and we will examine the hip joint anterior, laterally, as well as on the posterior aspects. So what we would be looking for, we will be looking at the skin over the joint. So which we will be observing the skin for any scar marks, swelling, redness. Then we will be observing both the hip joints and look at if they are symmetrical, the same plane. We will be looking at same from the anterior, lateral, and the posterior aspects. Then we will be looking at the muscle bulk over the quadriceps, hamstrings, over the gluteus. Okay, and we would be looking at if there are any muscle wasting. We will be looking at the bony abnormalities, especially the spine, lordosis, any scoliosis, which can be referred as a hip joint pain. The next we will be feel. We will be looking at the temperature of the hip joint. If there is any inflammation and any tenderness, then we will be asking. We will be palpating the hip joint. We will be looking at the bony components and especially the greater trochanter, the sacroiliac joint, the anterior superior iliac spine, the iliac crest. Then we would be looking at the uh, palpating just 2 centimeters below the midinguinal point to look for any trochanteric bursitis. Then we will be palpating the muscles to look for any gluteus and the psoas muscle pains. Then we will do the measurements. For measurements, we will be measuring the true length and the apparent length. The true length from the anterior superior iliac spine to the medial malleolus, and the apparent length from the umbilicus to the medial. The movements with the patient in supine position, we will be asking the person to do flexion, as flex the knee and the hip joint, and so that the knee joint can touch the abdomen as much as possible. So normally it's up to 0 to 125 degrees. Then we would be asking the person to do abduction of the hip joint with the knee joint extended. Then we will be asking the person to do adduction with the knee joint extended. So how far he will be able to cross over to the other aspects. Then with the knee joint flexed, we will ask him to do internal rotation as well as external rotation. We will ask the person then to be in a prone position and ask him to lift the hip joint to look for any extension restriction in the extensor of the hip joint. Some of the special tests with regard to the hip joint, the Trendelenburg test. So in this test, we ask the person to stand on one leg. So make sure you support the hip person, so that in order to prevent him from falling down. So normally, if they will be able to stand and there won't be any pelvic tilt, and if there is a weakness in the opposite side gluteus medius, which are the abductors, so there will be fall on the other side. Okay, so if this side he is able to, if he falls, the opposite side gluteus medius is affected. So this is the Trendelenburg test. The other test is the Thomas test for fixed flexion deformity. We would keep our hand below the just above the sacroiliac joint near the lumbar part. Okay, and we will ask the person to flex the knee joint and the hip joint as much as possible so that they can the knee joint comes to the hits the abdomen. Okay, so normally the leg will be straight. In case of fixed flexion deformity, you can see that the opposite leg is going in for flexion. So this is called as a flexion Thomas test to check for the fixed flexion deformity, any hip joint pathology. Now there is another one which is called as modified Thomas test. So here the patient sits at the edge of the table, okay, and the patient is asked to flex the hip and the knee joint. Okay, then we'd ask them to lie down, and we would be observing the hip joint. Okay, so if there is a flexion deformity, the pelvis will be rotating posteriorly. So this indicates that there is a fixed flexion deformity. The squeeze test, we would be asking the person to squeeze. Okay, finger examiner keeps the finger between the knee joint. Okay, and we would ask him to squeeze as much as possible. Okay, so this, if there is a pain, especially in case of osteitis pubis, so this might be exacerbated. So this indicates this is another test for the hip joint. The femoroacetabular impingement test. So here the patient lies in supine, the knee joint and the hip joints are flexed at 90 degrees. The examiner then externally rotates and then internally rotates to find out if there are any pain symptoms. So that can detect any labral impingement, the the acetabulum. If it is at any problem in the acetabulum, that would be detected by this test. Okay, that is the femoroacetabular impingement test. So the same can be done with the knee joint and a full extended posture also. So here you can see that it's been internally and externally rotated to find out if there are any impingement problems that can affect the hip joint. The other test with regard to the hip joints, never miss to examine the spinal examination is mandatory. Then we need to examine the next joint, the knee examination, and don't forget to examine the cardiovascular and the abdomen to rule out any cardiovascular as well as the pathology in the abdomen that can be referred to the hip joint. Thank you.